Today, we are unlocking the secrets of the nervous system. EMG and nerve conduction studies will be explained. Welcome to our channel. Today, we're diving into the fascinating world of electrodiagnostic medicine. We'll explore two key tests that help diagnose nerve and muscle disorders: electromyography, or EMG, and nerve conduction studies, or NCS. Did you know that these tests can reveal issues from your muscles and nerves that other tests can miss? Stay with me to learn how these powerful diagnostic tools work. Hi, I'm Dr. Suzanne Manzi, a board-certified pain management specialist with a secondary board certification from the American Board of Electrodiagnostic Medicine. In my practice at Performance Pain and Sports Medicine in Houston, Texas, I am so excited to talk to you about EMG and nerve conduction studies and how they can help diagnose neuromuscular disorders. If you or a loved one are experiencing unexplained numbness, tingling, muscle weakness, or nerve pain, this is the video for you. So let's start with the basics. What is electromyography, or EMG? EMG is a diagnostic procedure that evaluates the health of your muscles and the nerves that controls them. It's crucial in helping us understand various neuromuscular conditions. EMG works by measuring the electrical activity in muscles when they're at rest and also during contraction. And this helps us visualize how well your nerves are communicating with your muscles. So now you might wonder, when is an EMG necessary? We often recommend EMG for conditions like ALS, myasthenia gravis, herniated discs, and sciatica-type pain. Symptoms that typically lead to an EMG testing include persistent muscle weakness, unexplained paralysis, numbness, tingling, and even involuntary muscle twitching. These symptoms can be concerning, and an EMG helps us get to the root of the problem. Preparing for an EMG is straightforward but important. You want to avoid caffeine and certain medications before the test. You can wear comfortable, loose-fitting clothing on the day of the procedure. When you arrive, our team will guide you through the initial preparations to ensure you're ready for the test. We really like to ensure that your skin is free of any lotion or Vaseline, and we also recommend bathing prior to coming in for the study. We may ask you to change into a gown for easy access to your arms, legs, or spinal area. During the EMG, you'll be in a comfortable position, either sitting or lying down. At Performance Pain and Sports Medicine, I personally perform all my electromyographic studies. Being board certified in this field, I take the utmost care in providing my patients with the best testing available. The test usually begins with the nerve conduction studies, which entail hooking either your hands or your feet up with these electrodes and utilizing a small dose of electricity to elicit a response from your nerves. Once I complete the nerve conduction studies, I then turn to the EMG portion of the test, where I will insert a tiny needle electrode into each of the muscles that need to be tested. Each muscle is carefully selected to make the appropriate diagnosis. You might feel a slight discomfort similar to an injection, but it's generally well tolerated. The procedure typically takes about 30 to 60 minutes, depending on the number of muscles and nerves actually being tested. After the EMG nerve conduction study testing, you might experience some muscle soreness or slight bruising, but this should resolve quickly. I interpret the results in real time and discuss them with you. These results will provide valuable insights into your muscle and nerve function, helping us or your referring doctor to develop a targeted treatment plan. You may ask, what are the risks and the benefits of an EMG and nerve conduction study test? Electromyography is a safe procedure with minimal risks, such as minor discomfort and a slight risk of infection at the needle site. The benefits far outweigh the risks, as EMG provides critical diagnostic information that can guide effective treatment plans. This procedure can help us pinpoint the cause of your symptoms and tailor interventions to improve your quality of life. So now let's talk about nerve conduction studies. NCS is often performed alongside the EMG. The test measures how quickly electrical impulses move through your nerves. By stimulating the nerve and recording its response, we can then determine if there's nerve damage and its severity. Nerve conduction studies are particularly useful for diagnosing conditions like carpal tunnel syndrome, peripheral neuropathy, and Guillain-Barré. The procedure involves placing surface electrodes on your skin, which deliver a mild electrical impulse to stimulate the nerve. You may feel a tingling sensation, but it's not usually painful. Like an EMG, nerve conduction studies is the critical tool in diagnosing and understanding nerve-related issues. Preparation for nerve conduction studies is similar to the prep for the EMG portion of the test. We like to make sure your skin is clean and free of lotions. The test is quick, usually lasting between 15 to 30 minutes, and results from the nerve conduction studies can help determine the best course of treatment for nerve-related conditions. We combine the nerve conduction study with the EMG portion of the test. So now let's dive into some frequently asked questions about EMG and nerve conduction studies. First of all, does it hurt? Most patients describe the sensations during EMG and nerve conduction studies as mild discomfort. Second, how soon will I get my results? Well, typically you'll receive the results immediately, but the written report will usually be available within a few days to a week. Lastly, how can I prepare for the procedure? Simply follow our pre-test instructions and you'll be ready to go. Thank you so much for watching today. If you have any questions or need more information, don't hesitate to reach out to us at Performance Pain and Sports Medicine. Please like this video, subscribe to our channel, and leave your comments below. We are here to help you live a pain-free life.